A diagnosis of breast cancer can be life-altering. What follows is a labyrinth of doctor's appointments, tests, and potentially treatments. And that can be a frightening time for women. That's why breast cancer nurse navigators are so important. And joining me today is Coleen Morrison, a breast cancer nurse navigator at Jupiter Medical Center in the Comprehensive Cancer Program there. Coleen, thanks for joining us.
Glad to be here.
So tell me, what is a breast cancer nurse navigator or patient navigator, and how do they help women?
A breast cancer nurse navigator is someone that helps advocate for the patient and their family during their treatment for their diagnosis of breast cancer. So I help them meet any barriers or any obstacles that they have. I help them overcome them. And I think it's important because a patient is overwhelmed, scared, and they have one contact person amongst all their healthcare providers that they can come to and develop a close relationship with, someone they can trust.
So you were talking about barriers to care. What's a barrier to care? What do you see?
Different barriers like financial situations, transportation, things like making appointments, getting tests that need to be scheduled, a lot of different things like that, community resources that they might need to access and things like that they might need.
So what if a patient did have financial needs? In what way as a navigator are you helping them with that very difficult situation?
I can direct them to our financial counselors here at Jupiter Medical Center. I can help direct them to resources out in the community that have been set up for patients that have financial needs. And I can also help them look at their actual individual insurance and have some of the other insurance people through Jupiter Medical help me direct them in the best way to receive the care that they need.
And what about emotional support? I would think that one of the most immediate needs for a woman diagnosed with breast cancer is they probably need some hand-holding and emotional support. Tell me what you do.
As far as immediate needs, I think sometimes it's there is the emotional, but I think education is the most important thing. Patients want to know, they want to understand their disease, and they want to understand what treatment lies ahead of them. So I think one of my major roles is to educate patients and to help them understand what lies ahead, understand their diagnosis, because there's several different types of breast cancer. And there's a lot of information that they're getting from friends and families that might be, inaccurate, because it might be their breast cancer might be different from other people's. So I like to educate, and I like to prepare them for their treatment. As far as emotional support, I do offer emotional support, but I also refer them to our social worker that we have at Jupiter Medical Center so that they have other resources available to them for that as well.
So you were talking about education, and I would think that patients typically get a lot of information from their physician. How do you work hand in hand with the physician?
I work very closely with the entire medical team, with our surgeons. I work closely with our medical oncologists and the radiation oncologists. I'm kind of the hub to the spokes of the wheel, I tell the patient, and I kind of help collaborate all that with working very closely. And we have a very close team here that we all work very collaboratively for the patient. So I help with some of the communication between the patients and the doctors and vice versa.
Sometimes I've heard from women that there's this labyrinth of physicians and specialists that they need to see, and they kind of don't know where to go first. So how do you help them with that challenge?
At Jupiter Medical, we have what we call the multidisciplinary clinic, which is a wonderful resource for patients. They can come to one appointment and see the physicians that they need to see all in one appointment, plus our support service team is there to see the patient, which is a good option for patients. The doctors collaborate on the patient's care, so the 3 different team members are all have collaborated together and have presented their specialty to the patient, and the patient can come to one appointment and not feel that overwhelming feeling that they have to go to several different appointments at several different parts of the town, and they can just come to one appointment and see all their doctors there.
That sounds like a great resource for patients. So in one appointment, they're getting advice from lots of different experts. Who's in that clinic?
Well, they're seeing their surgeon, which we have fellowship-trained breast surgeons here at Jupiter Medical Center, so they can see their surgeon. They also see their medical oncologist, who would take care of any of the medical needs, such as chemotherapy or endocrine therapy, and then they also would see the radiation oncologist, which would talk to them about radiation if it was something that was part of their treatment plan. And then they also would see our support services. So we have someone from the physical therapy department comes in and talks to them about lymphedema and some other things that they might encounter after surgery. We have a social worker that meets up with them and might address their emotional needs. We also have a dietitian that sees them and talks to them about their special diet needs during their treatment and after.
So tell me about the journey for the patient as a nurse navigator at Jupiter Medical Center. When do you first come into contact with women who are diagnosed with breast cancer?
I usually know about their diagnosis within 24 hours. I want to be sure that they've spoke with their provider first and have gotten the information from their provider. And then I give them a call or I see them in person and we sit down and we discuss the diagnosis. I educate them on their specific diagnosis. And then we decide where they need to go first, which is usually to a surgeon. And I make sure that they don't meet any barriers making that appointment. I can help them get to that point where they can have that appointment, and then I touch base with them along the way through their treatment.
It really sounds like a valuable resource for women. Is this something that's available everywhere today at all hospitals?
No, it's not available in all hospitals, and I think what I'd like to see in the future is that it is available to everybody, because I think it is an asset that patients really need, and I know it's comforting during this overwhelming time for them, and I get a lot of positive feedback from the patients that it was a helpful experience for them to have a navigator.
Do you think that navigation actually improves the care that the woman is receiving?
Studies have shown that patients are more compliant when they have a navigator because they don't have to break through all the barriers. So, patients seem to have a better outcome afterwards. They're not as overwhelmed. They're able to make better educated decisions for themselves, and they're able to follow through on all their treatment plans in a timely manner, which is very important.
So in what way do you help women, you said, be compliant with their care? How do you as a navigator make sure that they're doing all the things they're supposed to be doing?
I touch base with them at important parts in times of their treatment. After their surgery, I'll touch base with them and address the surgical issues that they might have. The next step might be to see their medical oncologist. I make sure that happens in a timely manner, or their radiation oncologist, just to make sure that they follow through with whatever the next step is in their course of treatment. So I continue to follow them each step of the way and checking in when there's critical times in their treatment, when they might be changing providers.
So do you find that women at different stages of their journey have different needs? Like a woman just diagnosed might need certain things, but someone who's been on this journey, for 6 months or a year, they're down the road. Do they have different needs? What are those needs, and how do you help address them?
Patients' needs are as unique as they are. In the beginning, some of them really need emotional support, need a lot of education. A lot of them like to just take and get their education on their own, and I'm there to support them, to direct them in areas where they can go to get the correct information if they don't want it from me. When they're getting chemotherapy, they're a little more focused on what's going to happen to them at that time, whether it's losing their hair or not feeling well, and I can help them with that issue at that time. And radiation therapy is another area where they have different concerns, different side effects, different issues. Maybe it might be transportation at that time because it's, at a different time in their treatment plan where they might need help with transportation that they didn't need earlier on. So every step of the way might be different barriers, and I can help them with those as we come across them.
Is patient navigation a relatively new concept, and what used to happen to people before there were navigators?
I don't think it's a really new concept, and I think there used to be different terms. There used to be patient care coordinators, but I think the oncology part of the medical field really saw the need for a special person that was just had some education on the oncology aspect of it, specialized in the certain type of cancer that the patient might have, and was directed specifically to helping that type of patient. So I think it's narrowing in, and I think oncology has really started the ball rolling when it comes to the navigation.
So at Jupiter Medical Center, in your comprehensive cancer program, do you have different types of navigators for different diseases, and what are they?
We do, and we have a GYN navigator for any of the GYN female cancers. We have a thoracic navigator who does any lung cancer, and we have one for prostate cancer also that deals with that. And I'm sure there's probably more coming down the road because we're expanding so much, but those are the ones we currently have.
So personally, when you come in contact with a patient, what do you hope that they go away with? What do you hope is your impact?
I don't want them to feel alone. I want them to feel, even though we have a wonderful team and everybody is there for them, I want them to feel like they have one contact person, that they never feel alone, that they can come call me anytime, and I tell them that I'm 24/7. They can call me anytime. So I try to be there for them. I want them to know that I'm on their side. I'm going to help them get through the journey and the best I can. And I get a lot back from my patients. I give to my patients, but I get a lot back from my patients too. So that's why I do what I do.
What is most rewarding for you about being a patient navigator for breast cancer patients?
Just seeing the patient in the beginning when they're nervous and scared and don't think they can do it, and then following them through and coaching them, and then seeing them reach the survivorship stage and seeing how strong they are, and being there through the journey and watching them change and grow and learn, and just the strength that my patients have amazes me.
Do you find that you also end up helping the family members or loved ones as well?
I do. I am also an advocate for the family members. I deal with a lot of spouses and significant others, and a lot of moms whose daughters have breast cancer, and that's rewarding, just helping as a team, the whole family as a team, helping a mother tell her children about breast cancer, how to help her deal with the situation with her children, to talking to her own mother about it, and so I do advocate for everybody in the whole family.
That's an interesting word you've used a couple times now, advocate. How do you advocate for patients? How do you see yourself as an advocate?
I want to teach them so that they can be empowered to make their own decisions. I want them to have all the information that they need to make an educated decision. They need to feel like they have some power because so much has been taken away from them, and they need to feel like they have the strength to do this, and that's what I try to advocate for them so that they can do all that.
Coleen Morrison, Nurse Navigator for breast cancer patients at Jupiter Medical Center's Comprehensive Breast Care Program. Thank you so much for all that you do.
Oh, thank you.